talk about cardiac catheterizations. When treating children with heart conditions, sometimes we need more than just images. We need a closer look inside the heart. That's where cardiac catheterization comes in. It's a minimally invasive procedure used for both diagnostic and treating pediatric heart conditions. Let's talk about cardiac catheterizations. What is cardiac catheterization? This is a procedure where we insert a thin, flexible tube called a catheter inside a blood vessel from the leg and then guide it gently into the heart using x-rays. This allows us to visualize defects or abnormalities, check oxygen levels and pressures inside and outside of the heart. We can also use contrast dye to enhance the imaging so that we can see very small defects, abnormalities in the direction of blood flow. It even allows us to perform small repairs like closing a hole, widening a narrow valve, and all of this without open heart surgery. When is cardiac catheterization used? Commonly, it's used for diagnosing congenital heart defects, balloon angioplasty, which means opening up or widening narrow blood vessels, device closures for holes such as ASDs, VSDs, or PDAs, and assessing function before or after surgery. Is it safe and what are the risks? Luckily, it is a very safe procedure. There are a lot of precautions taken, especially when done in an experienced pediatric facility. However, as with any procedure, there are some risks, including but not limited to minor bleeding or bruising, rare allergic reactions to the dye or anesthesia, and very rarely arrhythmias or blood vessel injury. Cardiac catheterization helps us see more, do more, and treat smarter with less impact on your child's body. It's a powerful tool in modern pediatric heart care.